The great thing about Carolina's Medical Center is it's a part of Atrium Health, which is the largest health system in the Southeast and one of the largest in the country. We have over 200 physicians in our Musculoskeletal Institute, all of whom are involved in some way or other in our education program.
For any specialty that you're going to, this residency has people that are world-class doctors that are in it, that are connected to multiple fellowships around the country. It's the norm that most of our residents are going into their top choices.
The really neat thing, I think, in nearly each of our subspecialties is we have leaders within each of them. Many of the people either have been previously, presidents or in the presidential line for their subspecialty societies or involved in the board of directors of their subspecialty societies. So our faculty are highly involved on a national level.
We're very committed to a mentorship model. As mentors, it's somewhat of an apprenticeship feel, and that we really believe the right way to learn is one patient, one resident, and one attendant. We couple that with the most modern technology for virtual learning. We have outstanding lecture series and operative experiences in the cadaver lab. We have dry labs that have been staffed by our attendings as well. So the opportunities for learning are really abundant, and every resident has a chance to make the most of their experience here.
I think we do a very good job of integrating our residents within our practices. We have carved out time for them to learn the basic fundamentals of orthopedics, and sometimes that's best done in a didactic or a classroom setting. But we also have hands-on learning too, and we really put a top priority on surgical simulation. We have found that it gives our residents invaluable experience and confidence when they're performing live surgery on patients.
We have morning didactics every morning, and I really think it's a great way to bring all of our residents together on a daily basis for a lot of different reasons. It allows them to see each other, which is great. It allows for a little bit of accountability from peer to peer, which is also important.
One of the neat things about CMC is that our residents do about twice as many cases as residents in other programs.
We're the major level 1 trauma center for this entire region. A lot of learning comes with volume, and our volume is high in all areas. And that really gives our residents that best opportunity for learning. The complexity of the trauma that we and our residents are seeing is fairly high. And that's one of the things that we've looked at and developed some additional rotations throughout our kind of close-knit community.
We have a wonderful culture in our residency. It's a very diverse group. It's a self-perpetuating group because they love each other, they love the program, and that's created probably the best culture that I've seen for residents to learn in.
They would go from people that you just had a working professional relationship to people that I was talking to music about from all genres. Some attendings that I actually played sports with, and so it went all the way from some great professional relationships to true friendships.
We're very excited to meet you in person when situations allow, and look forward to telling you more about Carolina's Medical Center.